Hello everyone. Today we learn regarding pylonephritis. So what is that? So it is one type of the infection that is occurred into the kidney or the swollen infected kidney. It is acute or is a sudden and severe kidney infection. It is caused the kidney to swell and may permanently damage them. It is occurred and it can be permanent damage also. Then pyelonephritis can be life-threatening. When repeated or persistent attacks occur, the condition is called chronic pyelonephritis. The chronic form is rare, but it happens more often in children or people with urinary obstruction. Which are the causes? The infection usually starts in the lower urinary tract as a urinary tract infection. Bacteria enters the body throughout the urethra and begins to multiply and spread up to the bladder. From there, the bacteria travels through the uterus to the kidneys. Bacteria such as E. coli often cause of the infection. However, any serious infection in the bloodstream can also spread the kidney and they cause the acute pyelonephritis. Risk factor, acute pyelonephritis. So in that diabetes, HIV, then the enlarged prostate, then the any abnormality from the birth. Okay, so these all are the risk factor or the chronic kidney stones. These all are the condition risk factor for the acute pyelonephritis. Then other factors that will be also occur for that catheter use, then cystoscopic examination, then urinary tract surgery, then certain medication, then the nerve or spinal cord damage due to the damage also, spinal cord damage also the occur pyelonephritis, then chronic pyelonephritis. It is the forms of the condition are more common in people with urinary obstruction. This can be caused by UTIs, varicourethral reflex, or anatomical anomalies. Chronic pyelonephritis is more common in the children than the adult. Then clinical features of fever greater than 1 or 2 Fahrenheit, pain in abdomen, back, side, or the groin, painful or burning urination, cloudy urine, pus or blood in the urine, urge of or the frequent urination, feces smelling urine. Other symptoms can include the shaking or chills, nausea, vomiting, general acne or the ill feeling, fatigue, moist skin, and mental confusion. Then diagnostic test for the urinary test. So in that, a doctor will be check the fever, tenderness, abdomen, and the other common symptoms. If they suspected kidney infection, they will be ordered to urine test. That helps to check out the bacteria, concentration of the urine and the blood and the pus in the urine. Imaging study. So in that, for the people who doesn't respond to the treatment within the 72 hours, so for that the CT scan may be ordered. This test can also detect the obstruction within the urinary tract. Then radioactive imaging. So in that, the DAMSA test may be ordered if doctor suspected scarring or result of pyelonephritis. These imaging techniques can attract on injection or radioactive material. That healthcare professional inject the material throughout the vein and the arm. The material can travel the kidney. Image taken in the radioactive material pass through the kidney and show infected or scar area. Management antibiotics in that levofloxacin, ciprofloxacin, cotrimoxazole, and the ampicillin. Then hospital admission in case of drug therapy is ineffective. So for that severe kidney infection, doctor may admit the hospital and the length of the stay depends on the severity of the condition and how well the patient responds to the treatment. Then treatment may include the IV hydrogen antibiotics that is 24 to 48 hours. Then there will be likely 10 to 40 days oral antibiotics. Then after that, release from the hospital. And then surgery. So in that, if there is in case of the severe infection, nephrectomy may be necessary to remove the part of the kidney. Then urethritis. What is that? So it is a condition in that urethra tube that carries the urine that from the bladder outside of the body becomes inflamed and irritated. So in that, this is also urethritis is not the same of the UTIs. Urethritis is an inflammation of the urethra, while the UTI is an infection of the urinary tract. They may have similar symptoms but require different method of the treatment depending on the underlying cases of the urethra. Then causes. Which all are the causes? In the Neisseria, gonorrhea, chlamydia, tetanus, then the mycoplasma genitalium, then gonorrhea, HPV virus, herpes simplex virus, then cytomegalovirus, then types. Okay, so in that there are different types of the urethritis classified by the cause and the inflammation. They are gonococcal urethritis and the non-gonococcal urethritis. Gonococcal urethritis caused by the same bacteria that cause the STI, and it is possible, however, it irritates the STI. So in that, the search from the catheter or the kind of the genital trauma. Then signs and symptoms in men, the burning sensation, then itching, burning, then the presence of blood in the semen of or the urine discharged from the penis. So these all are the symptoms. Then women, more frequent urge to urinate, discomfort during urination, burning sensation, irritation, discharge, abnormal discharge from the vagina, then the STI. These all are the signs and symptoms. Then diagnostic test. So in that, doctors will ask the patient about the symptoms. They will likely also examine the genital area for the discharge, tenderness, sores, and the sign of the STIs. That can be helpful for the make or diagnosis. Then they may order to taste the anal and blood test, so in that HIV and the syphilis. And depending on the doctor and their lab, that can get the result, test the result back in as soon as few days. This allows them to start the treatment as soon as possible. Management. Azithromycin, an antibiotic typically taken on one-time dose. Doxycycline, oral antibiotics. Erythromycin, antibiotics that administered orally 4 hours a day for 7 days. Ofloxacin, oral antibiotics. Levofloxacin, oral antibiotics from the 7 days. Prevention. How you prevent? Use the condoms every time during sex. Then they get tested regularly. Protect others from the STI. Then they drink plenty of water. Then be aside from the safer sex partners. Thank you.